Peacock. I'm an associate professor in the Academy of Ambulatory Foot and Ankle Surgery, and this morning I want to show you a patient that had a chronic diabetic ulceration, which we treated with more of a traditional type procedure that I actually learned from Dr. Laborde, who's one of our members in the Academy, and he also is the head of the LSU Orthopedic Foot and Ankle Surgery Department. So I'll show you something he does with a lot of soft tissue type procedures that can help diabetics. Here's a status post 1 week Gastroc Recession, which we did for an ulceration. This ulcer was actually full thickness 1 week ago. You can begin to see it's actually beginning to heal in just 1 week. What we did with him, we made an incision in the back of his leg here. The incision is made a little medial in the gastroc area. His incision was a little larger than what we normally do because he has a lot of venous stasis issues, and I had to tie off a little vein that was actually anastomosed into the saphenous vein. And we basically cut all the way through the gastroc here, and also including the plantaris. This allows his foot now to go up a lot more, will take a lot of the pressure off the front of the foot and heal this ulceration. These types of ulcerations are actually limb threatening, so it's good to do this to heal these, and in my opinion it's good to do this even as preventive for ulceration. So even to do a gastroc when needed before the patient has an ulcer is a good idea. What this procedure basically entails is making an incision, avoiding your saphenous vein and your sural nerve, which is going to run laterally in most patients. And then you just take an army nave and go underneath your subcutaneous tissue there. You actually do incise the aponeurosis. You want to keep that open, not like in our flat foots, we close that back up. You want to keep this open so these patients don't develop any type of issues with compartment syndrome. Matter of fact, even though I had to tie a vein off in his leg, he didn't get much bleeding. Normally we do this with a subcuticular incision. With him, we chose to do basically nylon so that if he could have some drainage if he needed to. So anyway, what I want to show you with this was just how quick these ulcers can heal. The etiology of many of our diabetic ulcerations is excessive pressure, and they can be treated with soft tissue procedures. And if you'll come to one of our academy meetings, you'll hear a lot about this. There's some other procedures that are very good for this, very preventative measures for diabetic ulcerations, and also ways to correct ulcerations. And we have a great lecture by Dr. Laborde on this, and a lot of other different surgeons now are using his techniques to prevent ulcerations, also to heal ulcerations without having to do bone work.